Hi, Dr. Dike Drummond here from thehappymd.com with a training on what I consider to be the foundational skill of a quality physician leader, how to lead by asking questions. I'm going to show you how to always ask the most powerful questions, and in the end I'm going to show you what I call the Lone Ranger test to see if you've learned this lesson well. As physicians, we were trained to diagnose and treat, and we were also taught to lead by giving orders. And our team was meant to obey, our patients were meant to comply. What I can tell you is that when you take on a physician leadership role, where you're leading an administrative team, those skills don't work so well. Because if you're the one giving orders, you're not tapping into the skills and experience of everybody on your team. So in this video, let me show you how to stop giving orders and start asking questions. Here's one thing I know for sure. You don't have to have all the answers when you have a goal or a vision, a team, and some quality questions. What kind of questions? Well, you've heard this before. It's always stated as an open-ended question. Let me show you how to build an open-ended question every single time. It's actually quite easy. It depends on how you start the question in the first place. Always start your questions with one of two words. Are you ready? What or how? If you start with what or how, it'll always be an open-ended question. Open-ended question meaning one that cannot be answered yes or no. The person hears a what or a how question and they have to think before they answer. When you lead by asking questions, you always get the benefit of your entire team's skills and experience. Hey everybody, I'm looking for a better way to file these reports from consultations. What are your thoughts on how we can do it differently? One habit to get into is to simply take any statement you were going to make to your team and switch the first word for what or how, which guarantees you'll always be asking them an open-ended question. Now, here's what I call the Lone Ranger test, to tell whether or not you've learned this lesson well. Anytime you find yourself sitting in your office trying to figure out what to tell your team to do, you're being a Lone Ranger. You're succumbing to the Lone Ranger programming of our medical education. So when you find yourself all alone trying to figure it out, stop. Grab your team, put them in a meeting, and put out there a really good what or how question. Help your team solve the team's challenges. It's not your job to diagnose and treat and give orders when you're a true team leader as a physician. That's all for now. Keep breathing and have a great rest of your day.